Hello everyone, today we will be discussing the medical condition conjunctivitis. This presentation will begin by defining conjunctivitis and then discuss what causes this health condition, the symptoms commonly experienced, how best to treat it, and finally the method parents or legal guardians can use to decide the best treatment option. Conjunctivitis is the medical term used to describe infectious or non-infectious inflammation of the clear protective covering of the eye and inside the eyelid. This inflammation causes the eye to appear pink or red in colour, therefore conjunctivitis is generally referred to as pink eye. There are numerous causes of infectious and non-infectious conjunctivitis. However, viral and bacterial infection are the most common causes. Bacterial conjunctivitis develops from a bacterial infection on the eye and is highly contagious as it can be transferred from person to person through direct and indirect contact. Likewise, a viral infection on the eye will develop into viral conjunctivitis and is also highly contagious because of its ability to spread through direct and indirect contact. Transferring conjunctivitis through direct contact occurs when the germs are in direct contact with the susceptible tissue, such as eye drop bottles directly on the eye. Indirect contamination occurs when the germs move via a medium such as touching the infected eye with a finger and then touching the non-infected eye. When the body reacts to allergens such as pollen, it develops into allergic conjunctivitis, which is non-contagious, meaning it is not transferred from person to person. Irritant conjunctivitis develops from irritation in the eye and can occur from incorrect management of contact lenses. This is also non-contagious. The various types of conjunctivitis all share similar symptoms but vary slightly depending on the cause. All types of conjunctivitis cause discomfort moving the eye, an irritating sensation, cause a red or pink colour, and increase discharge and tear production, as seen in image 1. Bacterial conjunctivitis is identified by the presence of a yellowish mucus discharge, image 2, around the eye, which makes the eyelids stick together. Viral conjunctivitis produces a watery discharge from the eye, image 3. Allergic conjunctivitis is identified by the presence of common allergic symptoms such as a stuffy or itchy nose. Image 4 shows a child with puffy eyes, which is a common allergic reaction. Specific symptoms of irritant conjunctivitis can include both mucus and watery discharge. Treatment options for conjunctivitis differ depending on the cause. In most cases, conjunctivitis will clear up within 10 days without the use of treatment. However, in some cases, it can last up to 2 to 3 weeks. Without treatment, and in very rare instances, the infection can spread to different parts of the eye, including the cornea. When conjunctivitis symptoms begin to present, the use of contact lenses should be stopped, which will decrease irritation and the chance of spreading the infection to other parts of the eye. Patients who decide to not seek GP advice can use cold compresses and over-the-counter eye drops to relieve inflammation and dryness. To treat allergic conjunctivitis involves removing the allergen and using over-the-counter allergy medications and eye drops. Antibiotic eye drops are the most commonly prescribed treatment for bacterial conjunctivitis by the medical physicians. Treatment for viral conjunctivitis cannot be treated using antibiotics as they are only effective against bacteria. Instead, treatment includes management of the symptoms. However, it is important to seek medical help if the patient is experiencing pain in the eye, excess discharge, light sensitivity and blurriness, and intense redness. It is essential that children or adults who have not experienced conjunctivitis before see their GP for a proper assessment and correct diagnosis. By having a correct diagnosis ensures the suitable treatment is applied for the specific type of conjunctivitis. This is especially important for identifying if the conjunctivitis is caused by an allergic reaction, as the patient may be unaware of their allergy. Patients wanting to find out more about conjunctivitis should refer to government websites such as Health Direct and Better Health Channel, as the information found on these websites has been produced from a systematic procedure which analyzes results from multiple independent studies, thus removing any private bias. Thank you for listening.